So a physician assistant is part of the overall clinic community, healthcare community. We work alongside physicians very closely, kind of being an extension of their roles and duties. Then we work alongside helping manage patients and can do anything from new patient stuff to regular follow-ups to post-operative evaluations, hospital follow-ups, those types of things, and definitely a huge asset for a lot of the physicians to provide that more regular coverage that doesn't always get provided by the physicians just due to their busy schedules and demands. Trust is certainly one of the most important things that you need to do both as a provider but also any sort of allied healthcare professional. And you have to make the patients understand that you know what you're doing, that you know the topic, that you can answer questions, and that certainly helps them feel comfortable to take your recommendations and guidance. It's important to be honest with patients, make sure that you are telling them kind of what's going on. Don't be afraid to get back to patients. I need to look things up, and I think that bit goes a long way. And then I think a final thing is just showing empathy, that patients want to know that you hear them, that you care about them. One of the things I like a lot about rural medicine is that you are an access point, and we recognize that healthcare is somewhat limited in the rural system, and I think that the patients are different in a good way, in that they really enjoy the fact that you're here, they're responsive, they're appreciative. Patients out in rural medicine are just grateful that you're there, that you care, and I think that that's just a wonderful part of providing rural medicine. It's incredibly rewarding to build those relationships, to be a part of people's lives whenever they're in the healthcare system. Pathways getting into the physician assistant, and I think in my journey it was one of those that a very close mentor of mine kind of steered me towards, and sometimes it's those people outside of you that can see what you're best suited for, and I think in my situation that was it. Just getting into it, learning the medicine, getting the relationships with patients and colleagues, other physicians, I think it's just been a good spot for me. My pathway has always been within the kind of science field, healthcare field, patient support field, and so it's been kind of fine-tuning, experimentation with this avenue and that avenue. And I think that the most important thing is that experiment, find things that you enjoy, and don't force anything, because things are always able to be evolved or switched. Healthcare overall has been very rewarding to me. I've enjoyed doing it. I think it's a great career for me. I encourage people to consider it.